Israel's military says its raid on the Kamal Adwan hospital in northern Gaza is now over. The operation allegedly targeted a Hamas command center hidden in the compound. Israel says it's detained the hospital director and 240 others as suspected Hamas militants. The World Health Organization says the raid has shut down northern Gaza's last major medical facility.
The Kamal Adwan hospital earlier this month receiving supplies from the World Health Organization. It was the last major medical facility still functioning in northern Gaza, despite the fighting around it. But on Friday, Israeli forces raided the hospital. The WHO now says it is out of service. Some of the patients and staff were evacuated to a hospital further south in Gaza City.
The army entered Kamal Adwan Hospital at around 4 in the morning. They asked all the medical staff, the patients and visitors to go out into the courtyard. Then they separated us into groups, the medical staff and the patients. Then they got ambulances to take us away.
But the evacuation wasn't immediate.
The patients that were evacuated were held for interrogation for 24 hours. The army didn't care about their injuries and left them out in the cold all that time.
Israel defended Friday's raid of the hospital, saying Hamas fighters had been operating from there throughout the 15-month war and that the complex was a key stronghold. Palestinians accuse Israel of trying to depopulate northern Gaza to create a future buffer zone. Israel denies this and says its military operations are aimed at preventing Hamas, widely designated as a terror organization, from regrouping in the region.
I'd like to welcome Tarik Jasarevic. He is the spokesperson for the World Health Organization and joins us now from Geneva. Tarik, you've obviously been watching this very closely. What comes to mind for you? What can you tell us about the raid on the Kamal Adwan hospital in northern Gaza?
Well, the first thing that comes to anyone's mind is how it must feel to be a Palestinian in Gaza right now and throughout these months. What we are seeing is that the access to healthcare is becoming non-existent, especially in north of Gaza. We are doing everything we can, everything that Israel allows us to do, but it's simply not enough. And whatever we have done gets undone in a single raid. So Kamal Adwan Hospital is non-functional anymore. Indonesian hospital that is in north of Gaza cannot do much. Al-Awda Hospital the same. We try the best we can. Every day we try to go to hospitals, but unfortunately more than half of our requests to move are denied in recent months. So really, it's a desperate situation for people there, and the only solution really is the ceasefire, and that we as humanitarians can get that humanitarian space we need to try to keep health facilities from our WHO perspective, health system to do its work.
What can you tell us about the staff and particularly the patients there? You heard a man in the report say patients were interrogated in the cold for as long as 24 hours with little care for their injuries. And of course, there have been reports patients were since transported to hospitals, which at this point in the war are barely functional.
Well, I remember the very beginning of this escalation of the conflict last October, when there were first orders issued to evacuate hospitals. We were saying that some patients cannot simply be just moved away. Some patients need to be in a stable position. They need to be connected to support machines. And every time there is an order to evacuate patients, it's risking their lives. But again, what is really important is that we need to get to point that we have that access, that people who are injured can leave Gaza. There's more than 12,000 people who need to be evacuated medically, not only injured people, but also people with other diseases.
I hope you'll forgive me. I hope you'll forgive me for interrupting you. Everything you say, we take to heart. But I do want to know, what about these specific patients and staff at this particular hospital? What do you know has happened to them?
Well, we don't know. We have not been there. Our request to go to Kamal Adwan, as I said, in most of the cases denied. We will try to go tomorrow to Indonesian hospital where these people moved to see what happened to them and see if we can move them to Al-Shifa hospital, that's in Gaza City, where we have moved some other people. But again, we need access to have more information. We need to be there. We need to get to people. We need to make sure that people who need critically needed interventions to receive them wherever it's possible.
So you're largely operating in the dark here. Do you have any information about the director of the hospital, Hossam Abu Safiya?
We lost the contact with him. We don't know. We are deeply worried about him being detained and other medical staff that have been detained throughout last 15 months or so. We have been coming to Kamal Adwan on a regular basis when we have been given permission to do so. But again, we can only do what we are allowed to do. And unfortunately, what we see is that right now, those people who are still in north of Gaza, unfortunately, will not have access to health services.
That is Tarik Jasarevic, spokesperson for the World Health Organization, who has criticized these raids on the hospitals there as a death sentence for the Palestinian people. We thank you very much.
Thank you.